And that leads to the question many people may be asking: when can you receive the coronavirus vaccine? Today, some of the state's top doctors met to discuss Wisconsin's plans to distribute the vaccine as soon as possible. Adriana Mendez has the update.
At first, there will be more people eligible to receive the vaccine than the state has doses for. A Department of Health Services committee is trying to figure out who in Wisconsin will get the vaccine when the first shipments arrive. The state will be receiving about 50,000 COVID-19 vaccine doses from Pfizer and about 16,000 doses of the Moderna vaccine once approved by the Food and Drug Administration.
The whole purpose of prioritization is to ensure that the most critical people get the vaccine first.
Members of the State Disaster Medical Advisory Vaccine Committee have the task on developing guidance on who gets vaccinated first.
Recognizing that there's not going to be enough vaccine for how we currently define 1A.
Section 1A of the distribution plan are those who will be first in line for the vaccine, specifically long-term care facility residents and healthcare workers who have direct patient contact. Tuesday morning, the committee met to decide whether to include in other job titles like in-home caregivers.
These are oftentimes individuals living in the community, going back and forth from their homes. They're doing shopping and coming, and they're dealing with people who are highly vulnerable.
How we work out the logistics, that's a challenge, I agree, but that shouldn't preclude them from being listed.
EMTs who also have direct patient contact are also included in the 1A category. Job support coaches, those who assist people with disabilities at work, would be included in the next phase of vaccinations under essential workers. Finally, those who are considered low risk might have to wait until the summer to see a vaccine. And Pfizer's COVID-19 vaccine could be approved as early as...
That's Adriana Mendez reporting. In Northeast Wisconsin, healthcare leaders say the first round of vaccinations could begin as early as next week. The president and CEO of Prevea Health says preparations to receive shipments are underway. Now they just need to get the vaccine.
Technically, we could actually start to see that vaccine in our state next week, but then it's got to go through its inventory process, its distribution process. So maybe as early as next week, you'll start to see our first vaccinated individuals.